these questions all the time from companies, so we'd be remiss not to hear from those in the know. Our next moderator stays on top of everything in healthcare. She's the editor-in-chief from MedCity News. And during our first conversation, I realized what a wealth of information she could provide. Veronica will introduce you to her panel and help us get some much-needed answers. Thank you.
But not this one. MedCity covers innovation in healthcare, so we write about entrepreneurs and investors and hospital executives and pharma and medical device. And go ahead and start before the slides are quite ready. But before I was in health publishing, I was in tech publishing. And so in tech, it was about foosball tables and Xboxes. And when I moved into health, the meetings were much more serious, and people didn't laugh at my jokes. And I thought, man, why is everyone so tense and uptight? And then I started learning more about the FDA approval process. And I thought, well, okay, now I understand. And in my most recent job, I've met more medical device people, and I thought, wow, these people are even more uptight than the pharma people. And then I started learning more about their crazy medical device approval process from the FDA. So my policy has just been to keep asking questions and to listen and to pay attention and try to be understanding, and answering questions or asking questions what I'll be doing today. So we each have a slide to sort of introduce ourselves, and then we'll go into talking about selling into the hospitals. We'll go through how to get through to the decision makers, no cold calls, please. What you should do once you get in the door, and then what the discovery period is like from a vendor in terms of figuring out what clients need and how to help them get there. So, there we go. We'll start with Mitch.
So my name is Mitch Bryant. I'm the Enterprise Support Center Manager. So I handle pretty much every device from the wall out. I don't handle the deep clinical imaging type things, but 45 is a magical number for the last year and a half. That's how many RFPs I was a part of. Half of those I wrote from scratch. So I know exactly how it feels to try to get your device into the actual door.
Then we'll jump down to Kirk on the end.
Good afternoon, everyone. I'm Kirk Larson, the Vice President and Chief Information Officer of Children's Hospital Central California. We're one of the 10 largest pediatric hospitals in the country and located in California's Central Valley up in Fresno. And the reason that I shared a baker's dozen was my first week being a CIO at the hospital before I was where I am today. I was meeting with my staff for about half the day, and I came out of my office after several hours, and my assistant had taken several phone messages from me, and she had actually written each one on a pink slip and had put them all the way around the frame of my door. And I came out and I was kind of surprised, and I said, wow, it looks like there's at least a dozen of them there. And she said, well, actually there's a baker's dozen, Kirk. And the distinction is not so important that it was 13 versus 12, but being a math major, I quickly did the math in my head, and I said, do they have anything in common? And she said, well, for one thing, I don't think any of them knew you, but they all wanted 15 minutes of your time. So I thought, boy, if I gave 15 minutes to a baker's dozen worth of phone calls, that would be 3.5 hours of my time. And if you factor in all the spam email I get, I would probably spend 5 hours a day just responding to phone calls and emails that I didn't invite. And I'll talk a little bit more at my time about a more effective way to approach selling into a health system as opposed to asking for 15 minutes of someone's time and sending spam emails.
Dayna?
All right. Hi, everyone. I'm Dayna Neumann. My title says I am Vice President of Marketing and Strategy at FetterGroup, but like many of you in the audience, Our titles often defy what we actually do in our everyday lives. So I'll spare you the 2 pages of things that I actually do, but for this particular audience, I think what's most intriguing for you guys about what I do in my everyday is that I lead our new business development team. My company, FetterGroup, okay, you probably never heard about us, that's fine. But the majority of what we do is software development, change management platforms that we sell into the whole broad spectrum of healthcare, from Fortune 50 health benefits providers to large hospital conglomerates like the gentlemen that are joining me today, to startup device manufacturers who we actually just did an implementation last week of some of our software. So what does Tiger Woods have to do with selling into healthcare? We just have not had enough sports analogies in our presentations today, so I'm very fortunate to be able to provide one for you. So Tiger Woods is arguably the largest, well, he is the highest paid sports star in the world. So the business of Tiger Woods is golf. So what I ask you when you are selling to a healthcare company, regardless of where they are on the spectrum, keep in mind Tiger Woods. The business of Tiger Woods is golf. He does well and continues to do well when he focuses exclusively on the business of golf. We've all seen what happens to Tiger Woods when his focus is jeopardized. It's not good for the business of Tiger Woods. So take that same philosophy when you're going into healthcare companies, and it doesn't matter who you're selling to, but I would advise sell as high as you can, of course. But keep in mind, how are you going to help them continue doing the business of their business without forcing them to comply to some other type of role that's going to distract them from their ability to focus on their business, their core competency, and not try to be an expert in whatever your product or service might be.
So I know a little bit about cold calling because sometimes I want to talk to someone at a VP level of a company, and being a startup, some people have heard of MedCity News and some haven't. So I know I'm also interested in Kirk, what you have to say about how to get in the door and how to get through the clutter of email and pitch something that's really worthwhile.
Happy to share a few thoughts, and in doing so, I'll reflect on some of my experience. As I mentioned, this is the second hospital that I've been a CIO for, and before that, earlier in my career, I was a vendor for Cerner, which is a healthcare technology company that does electronic medical records, and before that, I was a consultant. So kind of the first phase of my career, I was selling, and now I'm buying. So just a couple thoughts that I'll share with you. The first is when you're attempting to kind of break in or have a dialogue with a hospital or with a prospective client, I always encourage people to know 3 things. One is to know your product. Another is to know the industry, namely healthcare and or technology. And finally, to know your client, your prospective client. You'd be surprised by how often I interact with people who they don't go 3 for 3. And it's really a turnoff because that's telling me that they're either literally not knowledgeable and or they don't have an interest in becoming knowledgeable. So I think coming in the door, having those levels of knowledge is essential. Secondly, it helps to find something that you have in common with the prospective buyer that you're trying to engage with. And that doesn't necessarily mean something personal. It might, but it really doesn't have to. Just if you, in my case, if you used to work for Cerner, if you are knowledgeable about the pediatric setting, if you went to the same school, something again that ultimately you need to find that commonality which enables the conversation to flow more with ease. And then finally, probably most importantly, something that is important to me is what I look for is what I call strategic partnerships, not for salespeople. We do business with, for example, a storage vendor called NetApp. And for those of you who aren't familiar with NetApp, they're a SAN vendor, so they sell essentially data storage. So when we save information on our patients, it ends up on a NetApp platform. And they're a really good example of who I would consider not salespeople, but instead strategic partners who are interested in getting to know us as a client. They're not salesy, and they also respect the fact that, to be honest, I'm not operating on their time frame, which is not to say that that's my ego, but it is that, like any other company, we also have a budget cycle and a fiscal year, and I can't always react in time of the vendor's convenience. And they recognize that, and they want to be part of a longer journey. And in addition to that, even after making the sale, they still have conversations with us and still engage with us. So it's not a kind of drop by, sell something, and race off. So those are a couple initial thoughts. And in applying those, a couple things that I found useful when I was selling and now when I'm buying, which is, and some of these are in some ways counterintuitive. One of them is to, a lot of times it's difficult to get to the person you're trying to speak to, but perhaps surprisingly, we do have processes in place that help us filter information that gets to us. So in my case, for example, and a lot of my peers have a similar system, my assistant, who's wonderful, and every time she takes a day off, I feel it tremendously, and that would actually be not a good day to call me. But she does a fine job of gathering the information that people want to share with me, because oftentimes it's not a gimmick or a lie that I'm in a meeting. I literally am in a meeting. But if people are willing to send information to her, she processes that, catalogs it, and that's something that I can review in the evening or at the end of the week. It's probably not going to be real time, but it is something that I can take a look at, and if it's appropriate, then I can reach out to that potential vendor. Also, as a relation to that, don't be turned off when someone suggests you talk to someone else in the organization, perhaps not at the same level. A lot of times I have directors who work for me who are closer to the day-to-day operations and would therefore be better judges of if a potential vendor is a good fit for us. Sometimes people take that as a turnoff, or me trying to shuffle them off and in a passive way saying no, but in fact that's not the case. So being patient is really important. As I said before, just because we don't respond immediately doesn't suggest a lack of interest, but instead just a sense of competing priorities. And finally, the last thing I'll share before I hand it back over is I'm a big proponent of LinkedIn. And I know that the initial knock on LinkedIn was, oh my gosh, it's all the salespeople, and there's no one on there but salespeople. But as time has gone by, people who are also buyers recognize that's a really valuable tool. And when people reach out to me, I love to put them into my LinkedIn, because I might not have need to interact or engage or even purchase something at that time. But by allowing me to put their information in there, it makes it really easy for me in 3 months, 6 months to be able to go back and track that person down and have a dialogue with them. So those are some of my initial thoughts on kind of that first stage in getting into a healthcare organization from a sales perspective.
Mitch, I'm sure you've had your share of cold calls. You want to share what works better?
Yes, please don't put a calendar meeting on my calendar if I don't know who you are. Not only will I not decline it, but I will delete it. So assuming that I have 15 minutes, as Kirk says, please don't tell me you just need 20 minutes, because honestly, I don't have 20 minutes. I see a lot of folks come in, they only need 20 minutes, I carve out 30, and an hour later I'm trying to literally get you out the door because I'm an hour late for a previous appointment. I love websites, so if you've got a decent website, I will do my research. I'd like for you to send me product material. Please give me an opportunity to read it. As Kirk probably does, that's my 9:30 homework at night. I will print out product material, we'll take your literature, and I will look at it later on. I have an 8-hour calendar, and I spend about 20 hours working within that 8 hours. So there's a lot of times where it might take me a week before I get back to somebody. As well, be careful about those end runs. You've spoken to me twice, and then you go to my CIO. Then my CIO sends you back down to me. it's not a good way to create a relationship with me. And at the end of the day, don't sell me a widget. I can buy a widget anywhere. And although there are some pretty neat technology I've seen today, eventually somebody else will sell that exact same widget. Sell me a solution. Sell me something that I can provide to my clinicians to provide them a service. I have 5 hospitals, over 170 physician practice locations. We're 12,000 employees strong. We take close to 11,000 calls at our support desk. I manage and support close to 18,000 devices, computers, printers, etc. And that's literally growing this year. I just installed over 1,000 thin clients into our patient exam rooms in our ambulatory sites. So I definitely know what the devices are. I'm definitely always looking for another device, and I have no money. My budget was done 6 months ago, and I had to decide what I was going to spend last year for this year. So while your product is fantastic, now I have to figure out how to go to Kirk to find $250,000 to bring your product in when Kirk just asked me to take $100,000 out of my budget and give it to her because she found a product that was bigger, faster, and better. So as to what Kirk says, it may take us a while to build that relationship. And I'm competing with, I'm competing with the imaging equipment as well, just to bring my product in the door.
Dayna, I know you have a policy against cold calls, so what do you do
Yes, the cold
instead?
call is dead. In case anybody hasn't heard this yet, the cold call is dead. Social networking killed the cold call, just so you know. So just be out in social media. This is, a few people have been talking about this. This is not just, for people under the age of 20. If you are not developing your personal brand, nobody knows who they're buying from. And they don't want to be sold to, but they love to buy. Who doesn't love to buy? You love to buy. You hate to be sold to. So just keep that in mind when you're calling on Mitch and Kirk. And I have responded, not to yours, but I have responded to your RFPs in the past. Show your personality, be totally comfortable with it, and likewise, give them the ability to understand your personality as well. I have to imagine that for you guys in your world, the people that you're networking with, if you hear a recommendation about using a particular product, service, person, etc., that is your golden ticket, right? I mean, you really want to get off of his, the framework of his door. You make sure that he actually is calling you because he has heard how fabulous whatever it is that you're doing is going to impact his business. And that brings me to what I think is, again, this is a common theme with me, but if you don't know who is going to use your product or service, you're sunk. Because the only way to tell these guys about it who are making, the budget people, the people that have the budget, aren't the people using it, right? So just always keep that in mind of who's actually going to be using it. I think we're going to talk about this later, but who's actually going to be using it is the second sell. So you need to get in with these guys, tell them how you're going to help them with their budget shell game, because that's what it is, right? I mean, everybody gets that. Healthcare people have a budget, and it's all about how are they going to use that budget literally to the penny so they get the same budget or more the next year. So it's like this big shell game, and when you figure that out, and then when they budget dump, you probably do. Mitch doesn't do that, no. But everybody budget dumps, right? So there are certain times of the year, and if you're there at the right time, or if they know and they understand that they want to work with you, or like Mitch was saying, if the shell game goes in your favor, fabulous, but the reality is a lot of people budget dump, and I've been the very welcome beneficiary of budget dumps in the past, and it's pretty great. So if you're already working with them and showing them, hey, look, these are the things in the future that we want to do for you that are going to help you do the business of your business better, more effectively, save you money, make you money, they're going to be waiting for that opportunity to give you the money that they have already outlined in their little shell game.
Kirk, you said that a vendor should know his or her product. Do you find that people don't know how to explain what they're actually selling? I was curious about, that was one of your three tips.
Yeah, in my experience, I think that I have seen times where people absolutely do not know their product. Either they're new or I don't know what their issue is, but I had someone asking me how it worked, and I said, if I knew, I would have your job, wouldn't I? But more often than not, that's not the case. Instead, what occurs is people have a degree of knowledge, but not at the right level. For example, if you're speaking with a CIO and maybe the chief nurse and others, you want to be able to speak to it at a high level so that they understand what the strategic value of that product is, how that's going to enable the mission of the hospital to be achieved, and so on. In contrast, if you're speaking with the manager of business systems, he or she's going to want to understand on a technical level, have a more engineering-focused conversation as to how is this product going to interface into our network and work with what we have. So you need to ensure that you have the right, you know who you're speaking to, for one, but you also have the right support with you. So if you're going to have an in-depth technical conversation, there is nothing wrong with bringing with what's frequently called a sales engineer, or someone who has that technical knowledge that they can speak to it, as opposed to if you're having a dialogue at a higher level, ensure that you can have the conversation at that level appropriately.
If I could add one more thing, remember that the hour that you have in front of us, you know, at that same time we're getting 45 emails and we're got 6 meetings ahead of us. So when Kirk and I are in the same room, you have to hit both points, but you will start to lose us in that 30, 40 minutes, because I'm also kind of sort of checking my BlackBerry but not trying to be rude, and then there's 3 fires. So try to get your point across in the first 30 minutes and be willing to leave something behind, because I will take the time to read it later on. And it needs to answer, I don't need marketing material. I can go to the front page of your website, see how cool your stuff is. I need to understand what your product does for me and all the technical stuff behind that. That's what I'm going to read at 9:30 at night. Quite frankly, gets me a little excited. Not what the PR people put in front of me.
So what about, sorry. So I'm curious, what about demos for you guys? I mean, I'm in the software world, you know, it's like optimizing the way that they do their business, and it's a lot of change for people. And so how does the demo work for you? And how do you like to get a demo?
When you get to that point, please make sure it works, because there's nothing worse than getting to the facility and you needed internet access for your demo. It doesn't work. But when we're ready for a demo, I absolutely want to see a demo. And don't give me what you've created. This is a perfect hospital. Try to find something that will let you mirror exactly what they're looking for. And to Kirk's point, know my business. Kirk has a children's hospital, pediatrics. I have adult as well, and I have ambulatory. So where's your product going to fit? And it cannot fit universally all the way across. It's either ambulatory, pediatric, oncology, whatever it is. But I absolutely love demos, and please don't drag them out. If you can't get your product in front of me within the first 15 minutes of a demo, that's inefficient. Because if I want to go further, that's when I'll pull in really all the smart geeks that are going to tear you apart for the next couple hours. Get your point across in the 15 minutes with your demo, 15 minutes worth of a high overview, and then allow us to interact. And within about that 40, 45 minutes, we're kind of concluding, and then we can spend the last 10, 15 minutes with anything else.
So like for device people, so like if you had a device person come to you, same thing, I mean, they leave it behind.
Oh yeah, if you're not willing to leave it behind, why do I want your product?
Okay.
If you're not willing to send an engineer to help my folks install it and set it up, I don't want to invest any money in you, quite frankly. If you have a product that's going to do something bigger, better, faster, whatever, over the current products that I have, be willing to invest the time and money to bring it in, hook it up, and do a proof of concept, or let me have it for a couple days. Mobile cart, just got a brand new mobile cart for someone's trying to get in the door. It does me no good to look at the mobile cart, been there, done that, seen them. But if I'm willing to put it out on the floor and let the clinicians use your mobile cart for 30 days, that's where you're going to get your sale.
Any advice on how to win the conversation with the super geeks?
Bring a super geek with you. I'm telling you, I'm being honest. I've seen a salesperson get torn apart in the first 5 minutes. And it's okay, they don't have to be on site. We're a technology. Put them on WebEx, put them on a conference call. I can put 5 or 6 of my folks in a room. I'll walk out in the 10 minutes because I'm done. It's allow them their opportunity. Put a super geek on the phone with them. Allow them to go to town.
And if I might go back to LinkedIn, do you all have time for participating in discussions on LinkedIn? Are there any groups that you like? Do you accept all invitations? Kirk, do you have any rules you use on LinkedIn? What works, what doesn't?
Sure. I typically accept all invitations. There has to be some sort of logical connection. So certainly anyone who attended here today, that would make sense. It's people who spam and send out 50,000 invitations, or they send me something in another language. I usually don't accept those, but and it happens. I mean, and I suspect that it's just a foreign language spam. I don't really know, but for the most part, I do accept everything that comes my way. And there are numerous groups that I like to participate in. I think, unfortunately, LinkedIn has a limit on how many you can be in, so it forces me to be a little bit selective, but I think I'm probably in 50 or 60 different groups, and I manage the communication that way as well. You can set it so that what you don't want to do is set it so all the communication comes to you automatically. My email box went berserk with every update from every group, but you can set it so you can check the frequency of the group. And so I think that's another way for me to meet people as well.
Yeah, don't link in me and then 30 seconds later spam me. I accepted your invitation, so send me something of value. Because if I accepted you, obviously I'm willing to look at your product or your service. Don't spam me right away. Offer to send me literature. I know it sounds funny in a digital world, but I really I will print out your product material, or I'll ask you to send me something, because again, that's my 9:30 homework at night.
Well, we saw a great video in the last presentation. We have a lot of video content. YouTube is obviously the place to be. If you don't have a YouTube channel, stop everything tonight after you have cocktails and go make one, although be careful after you've had cocktails. But I tell my teams, your network is your most powerful asset. Always be aware of how you're cultivating it, and LinkedIn is the place to cultivate it. It's so easy and it's so much fun. You should be having fun with it. Health 2.0 is a group that I love, 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 love. If you guys aren't already in Health 2.0, it's fabulous. Another one I like for all you salespeople out there is Sales Playbook. It's a little more general on the sales side, but it's very practical, it's tactical. It's just a lot of people talking about a lot of the things that we're talking about up here in other industries, but why can't you take best practices from people selling into other industries, right? So anyway, those are two that I love and I participate in, and video content on your LinkedIn site, or sending Mitch a link to your YouTube, and then all he has to do is just bloop, and couldn't be easier, right? So at the moment of engagement, we've all been talking about engagement, at that moment of engagement with someone like Mitch, bam, you're giving them something that they can actually take with them. It's actionable. He can share it with all of his buddies, and now you've just gone viral.
I think a general rule of thumb about LinkedIn is 10 times your age. So if you don't have 10 times your age in contacts, then you're probably not getting enough out of the system. And I don't have 10 times my age, so I'm working on that, trying to push that number up.
Right, if you're in sales and you're creating your brand, if you don't have that 500 plus, really? I mean, come on. You've got to have, everybody, if you get 500 plus, that's the secret code. 500 plus, it just says 500 plus connections. It never says that you have 501 or 10,000. It just says 500 plus. So get to 500 plus.
Okay, so you're in the door. You've worked your network. You have not annoyed anyone. You've not sent any unsolicited meeting notices. You're in the door. What should we do? What's the next step, Kirk, for working successfully with a vendor?
Yeah, I think at that point you want to figure out who are the right people for you to meet with, and really ensure in advance of the meeting what the prospective client wants to get out of the meeting, not what you want to get out of the meeting, because most likely what you want to get out of it is a sale. But again, going back to one of my earlier comments, I would encourage folks to figure out how do we become a strategic partner with the client. And I think a lot of the examples that we've shared here today, I think are consistent with that. Back to Mitch's point, and I like to remind people of this, like a demo, which oftentimes is an appropriate next step. Demo means demo. It does not mean show me PowerPoint slides of what it would be like. It doesn't mean show me a made-up environment that would kind of be like what it would be for me to work with. What we really want to see when you demo something is a connection literally to your test environment, period. And like Mitch said, we don't want it not to work. We don't want you to be asking me why is the internet connection too slow. That's an example of recognizing here's what the prospective client wants to get out of this conversation, out of this dialogue, and doing that homework in advance and ensuring that you understand who your audience is, what they're looking for. That's what's really going to enable the conversation to move forward. And to me, and again, I know we're starting to kind of walk a fine line between me being a buyer and people having quotas that they need to reach, but to me, let's not talk about how much it costs or making a sale. Instead, my interest is in how is this going to help me and my hospital achieve our mission, and from there, everything will fall into place in terms of what are we going to buy, when are we going to buy it, what's the price going to be. That's, to me, that's after the fact. That's the easy part. The challenging part is establishing that, again, that strategic partnership.
Can you give an example recently of a strategic partnership that's worked out well, or maybe a pitch that resonated that way with you?
Sure. I'd go back to the NetApp example. When NetApp approached us, I had just joined Children's Hospital, and we were in a position where we knew we had to do something because our existing storage vendor was at end of life, and we were going to make a purchase. And the approach they took with us was what I would call highly consultative, where they wanted to understand what our challenges were, what we were hoping to achieve, and we never, in the first several meetings, never even talked about the price or any of those more logistical or tactical things. And we actually together sat down collaboratively, the NetApp folks and the appropriate ones, the technical folks, sat down with my team, and we were able to kind of map out jointly what we needed to achieve our goals. And in doing so, it really struck that chord of a strategic partnership. And I think as time went by, surprise, surprise, being a prospective seller, our needs changed. I know that's shocking in the sales process. And because NetApp was, again, I think a partner, not a salesperson, they were able and willing, to be honest, to react to our changing needs, and were able to accommodate what we needed in their proposal, so that what we ended up buying was what we needed and not what they needed to sell at that point in time.
Dayna, can you talk about how you get there to that same spot of what they need as opposed to what your beautiful software product?
Absolutely. So it's actually kind of simple, really, but it sounds simple, but it's obviously a little more difficult in practice, is asking questions. I tell my team, I do it myself, if the first meeting that you have with a prospective buyer, if all you do is ask them questions and they talk the entire time, it is a raging success of a sales call. Because now you understand even deeper. Now you've already done your research, you've already checked into all of the different news elements that are happening around their business. You already understand, if you're NetApp, you already understand, are there legacy systems I need to be aware of? Where have they been before? What worked, what didn't work? You have to go a couple of years back to understand, have they done an implementation like this before? Why are they talking to me now? It must have gone poorly after 18 months, which is typically the life cycle of a software application, is that they buy it, they're excited about it, and then the users don't use it, and 18 months later and $500,000, and everybody's scratching their heads going, gosh, this really didn't pay out the way we wanted it to. And so now you're in there talking to them about the exact same thing, and you're asking them, have you ever been here before, and what did it feel like? What happened? How do you manage change, and what would you do differently in the future? All of those great questions to help you understanding your product, understanding who it is that's going to be using it. Now you're able to deliver exactly that information that's going to help them understand why they need to choose your product. If indeed, the other thing is, if you're asking all these questions in the beginning, it might not be a fit, right? I mean, you might think it's a fit, but if it's not a fit, stop wasting your time and move on to someone else, right? So asking all of those questions is absolutely the best way to understand whether or not you have a chance at helping them to grow their business, and yours, obviously.
Does that answer the question? I think so. I hope so. Some people are checking their email, but others are paying attention.
No, they're tweeting,
So-
right? You're live tweeting.
Great wisdom.
Yes.
Mitch, did you?
I'm gonna go with that. Yeah.
So, yeah, you have one shot, obviously, to try to get to the next step. So help me understand what your product can do for me. What solution are you providing? And certainly look up a few things. We're in the area, we're building a brand new women and children's part of a hospital. We can't build out, so we're literally building floors up. So what are you going to bring to me that's going to make that endeavor better? You know, and it's not. You're not going to sell me tomorrow. I don't even have you in my system. It'll take a week to get you in my system. Please don't expect a PO tomorrow. At the end of the day, depending on what it is, I have to go talk to Kirk. So I have to sell my idea to Kirk. And I have to stand in front of Kirk and tell him that $225,000 that I didn't budget for last year, I gotta have today. So you need to help me with enough information that I feel comfortable, first of all, approaching Kirk, and that I can sell that product to him. And Kirk may ask me about the business need, or he may ask me about the technical aspect. I need to be armed with that. And not only do I have to sell it to Kirk, but I have to sell it to Kirk's direct reports. I've been in front of my CIO's direct reports. There's 12 of them. Now I've got 12 people asking me questions. So you need to be ready to partner with me, and that process might take a week, 2 weeks, a month, 2 months. But eventually, if you and I can figure out how your solution fits, I'm going to be just as aggressive for you to get it into the door. And remember, you will make a mistake. Your product will fail me. Your solution will have a problem. And I will change my mind 12 times. How you recover from that is more important than you shipping me a bad product. I don't really want any excuses about FedEx or UPS, or just get me the product. Just get it in the door. Once you've made the sale, you gotta take care of me. Because at the end of the day, if Kirk doesn't like it, I don't like it, we're not gonna go forth. And you know, Kirk was talking about net apps. I'm not in the storage world in our organization. But if I was looking for a storage solution, I'm gonna trust Kirk's word over your marketing material. So it's really important that once you've sold Kirk, that you provide those case studies, or that I get the references. And the references need to be close to who I am. I don't want to hear from a finance company about your product. Doesn't really mean anything. I'm healthcare. And Kirk probably doesn't want to hear about an adult side of healthcare. He's pediatric. So try to find your clients that are closer to who I am, because I'm going to call them and I'm going to ask them about your product.
So we'll do final thoughts and then go to questions. Dayna, last best save from a sale you thought was lost, or favorite client that you liked working with?
Well, I think it was really interesting is when you do get the absolute privilege and honor to be called a partner and not a vendor. It's like, hallelujah, you just made it. You made it. You made it to the stage. And so you know you've made it to that true partnership moment when you're being included and asked to participate in strategy meetings with the very folks that you're partnering with. That to me is where you know that you've really become a partner and not a vendor. And I would encourage everyone to try to strive to be a true partner, regardless of whether your product or service has a short or long-term shelf life. Because if it has a short-term shelf life, then you're going to constantly be reselling it. If it has a long-term shelf life, then you're always going to have an opportunity to upsell and find extensions to the products and the services that you're selling into these organizations. So for me personally, when I hear partner from someone that is buying from me, I am absolutely thrilled, and that's always the goal, is to become the partner.
Kirk, any last thoughts?
I would agree with Dayna, just the importance of achieving that strategic partner level with your buyer. At Children's Hospital and IT, we maintain an active list of who we consider to be our strategic partners. We support over 300 systems at our hospital. There's probably not more than 15 names on the list of people who we consider to be strategic partners. And strategic partners are people that I want to talk to, who I want to call, who I want to come see me. And the people that, or the partners who end up on that list are in a really good place to be part of what I would consider our journey and where we're headed. And they're going to play an active role in that. And I would encourage folks to figure out how to get onto those lists, because in our case, there's literally a spreadsheet on our IT leadership team drive where we maintain that. Even if it doesn't exist at other prospective buyer sites, it exists in someone's mind, I assure you that. And I would encourage everyone to, if not that term, something similar, ask people, hey, how do I become your partner, your strategic partner? Because almost anyone can be a salesperson. But if you can get to that top 5% and actually be a strategic partner with your buyer, that's the place you want to be.
Are there any new areas on your list of places you need a strategic partner, or any new technologies or needs in the hospital? Put you on the spot?
We're always looking for for new partners. Probably the biggest one that's on my mind right now is business intelligence and data warehousing. We're looking for someone who's going to be our ultimate partner there. So if folks are in BI or data warehousing, I'd certainly welcome that conversation.
Mitch, what next 45 RFPs are you going to write, or what's the next one on your list, I guess?
Oh, wow.
That's easier, a little bit.
You know, we're undertaking, if you've heard of a small little teeny application called Epic, we're undertaking that. We started last year. In the summer of 2013, we'll finally be done. But I also know that the next 2-year strategy is building more and more, and we can't buy another hospital, we can't create another hospital, we're kind of bedlocked. So I need to find the next product that's going to give us that 2 minutes back per nurse, per day, per hour. I need to, mobility is huge. And we've all talked about, I've got a BlackBerry and iPhone with me, an iPad over there and all that stuff. Be careful how much you want to throw on that device if I can't manage it. I'm not going to give 1,000 iPads out to my nursing staff. I'm not. They're going to break them, they're going to lose them, they're going to not use them correctly. And I have an audience from 18 to 98. So I have some nurses that struggle with technology. And then I've got the 18, 19-year-old who has, their gadgets everywhere. So I got to find a solution that takes care of all of them, but I have to manage it. So when you bring a product to me, please don't tell me at the end of the sale, you're going to have to touch every single one of the devices to set them up and keep them going. So figure out again, a partner. No offense to anybody in here, but vendors are a dime a dozen. I only have a short list of partners, and I'm extremely loyal to them, even when you make mistakes, because eventually you're going to recover. I'm extremely loyal to my partners. Vendors, a dime a dozen.
Any questions? Anybody still awake enough to ask any questions?
It's almost cocktail hour.
Hi, I'm Rob Swiftke. Thanks for all the advice, daunting though it is. You kind of partially answered my question, but I'm interested in reality. There's a lot of press about iPad, Android rollouts in hospitals. Either BYOD, bring your own, or centrally sourced. Although clearly you're not going to buy 1,000 iPads for all your nurses. If you've got any observations on whether there are BYOD problems and you are sourcing touchscreen technologies, mobile devices, I'd just be interested to hear about them. Thanks.
Everything's driven by obviously what the clinicians want. We just rolled out touchscreen, all-in-one computers for our anesthesiologists. I thought they were going to freak out. I mean, it just was like we reinvented something. But BYOD is huge. Gone are the days, quite frankly, I think in a few years, where everybody has a desktop at their side. So your product has to fit on the platform you're going to put it on. I can virtualize any application. I have 120 applications virtualized. Has anybody tried to use Outlook on an iPad and you're doing this? And it's great to see your email on an iPad through Outlook, but it doesn't work very well. So your product has to fit onto the platform. It needs to be very, very user-friendly and needs to fit within that space. Epic, we purchased hundreds and thousands of 22-inch widescreen monitors. Epic was smart enough that when they built the iPad application, they realized they only have this much real estate. So be careful with the real estate that you don't give me an application that fits on a 22-inch widescreen monitor and put it on a 7-inch device.
Actually, if you're putting your product or selling your product, it's an app, is that right? Or it's,
Yeah, effectively. Yeah.
okay, so I'm curious, follow-up is if you are going to put this into your clinician space, how important is testing in that environment to you, or making sure that he's doing the testing and the training inside your world? Is that always a part of, like, is that always a part of your contract? Is that
Absolutely.
standard boilerplate stuff? And likewise, are your people, do you have different teams that do that? Or is it the same folks that are doing, you know, beginning to end of your cycle?
And you need to have a clinician. I'm a techie person, so I'm going to test your product in my world and how it fits. But at the end of the day, if you don't have a doctor, nurse, or something, talking to the doctors and nurse and checking with them, you're going to have zero adoption, and eventually it'll just die out.
And I'll add briefly on the BYOD question. At our hospital, we use VMware. So any device that can download the VMware View client, you can leverage effectively a BYOD. So, for example, in our environment, we're Windows, of course, but if you can download that client onto a Mac, onto an iPad, onto an Android, you can access the clinical network through BYOD. And the nice part of that is because it's virtual, at no time is there patient data on a physical device, because you're accessing the virtual desktop on the back end.
Let's say you found a product that you really like. Are you required to have at least 2 other competitive quotes before you can make the purchase decision?
Sometimes I guess it depends on what it is, how much it is, if I'm familiar with the product, if we've established a relationship. New person coming in, new technology, there's opportunities to not do that. If it's current technology, I obviously do like to shop around, because at the end of the day, dollars are very few and precious. I want to make sure I make the right decision. So a lot of times I'm looking at the other opportunities to make sure your product fits. But I'd say 50, 60% of the time I don't have to, or I'm not required to.
In our case, a very similar answer, but I would add that where I was previously, I was at a county-owned public safety net hospital, and we were in fact required by law to have multiple, we had to put out an RFP, have multiple bids, and it would be it was possible yet very challenging to demonstrate why you would not need to go through that process. So again, I think it really pays to know your prospective buyers, because in some cases, they can't just buy it on the side. They'd have to go through an RFP process.
It's very helpful if you do some of the homework too. Do you have an ROI calculator to help me? Do you have a template? Do you have a comparison? And I would not slam your competition, because I really don't want to hear that. I want to hear what you can do for me. Don't walk in and tell me what they can't do for me. Let's just talk about you. But if you have some of that material already ready, an Excel spreadsheet and those type of things, then you're doing some of the work I have to do at 9:30, so I'm more apt to include your information.
We actually took the strategy of don't bash anybody kind of a step further, and we actually talk about how our software plays nice with others, because we know that they have lots of people that they're working with in very specific areas, people that we're competing with, blah, 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 blah. So we took the strategy of, you have a big sandbox and we all want to play together. So we will play nice with others. And so if you have, and then what ends up happening is that they're now telling you about your competitor's product, which is kind of interesting. And then they're also sharing with you, I think, really interesting information about, you know, how they envision everything interconnecting and all of that. And so now you're having a completely different conversation when you get over your fears about a competitor, and then you'll find yourself in a place where they don't have to do an RFP because everybody has unanimously decided to use you because you've been a thought leader and pushing your ideas to help them improve their business.
Hi, my name is Andrea Shofsky. I'm one of the co-founders at Kirk, and I'm a pediatrician at Children's Hospital of Boston. My question pertains to, besides the licensing fees for purchasing software, what roughly percentage do you allocate to professional services or consulting services, or just the costs associated with implementation and subsequent maintenance of that software?
So we typically have, it depends on the magnitude, honestly, and if it's, most of what we're doing is brand new, so we're typically doing custom software development. Some things are modular, but most of the time, if it's brand new, then we always have about 10% for what we would call discovery. We develop in an agile Scrum methodology. I'm sorry to geek out a little bit, but anyway, so what that means is that there really isn't this traditional waterfall development cycle where you do all this discovery up front and you can say, oh, it's 10%. Because we do this ongoing process, it's a little bit different, but typically it's about 10% for discovery, and then depending again on whether they've already been using our product, when it comes to training and implementation, we typically put approximately 5% there as well. But one of the things that we also realize is, you know, we're kind of our software division operates very much like a startup. So we're not very well known yet. We're, you know, sort of small and nimble and flexible, and we use that to our advantage. But you said licensing. So what we recognized was licensing is an issue for us and everybody else. Nobody likes an unknown variable when they're doing their budgets. Am I right? They want to know what is the all-in cost of ownership. And when you're talking about software, everyone gets really uncomfortable about usage fees and licensing fees because they're not sure how specifically to allocate that to the different divisions that are using it. And so something that we've learned that's been really, really helpful for us is that we give an all-in budget number for them so that they can always understand exactly how much of their budget's going to be allocated to that spend. Does that help?
Thank you so much, everyone.